will continue, and the day-to-day business of delivering quality aged care will also continue as usual. With my ministerial colleagues, Susan Lay and Fiona Nash, we will implement, monitor and tweak as need be. While it's early days in my role, it will evolve, and my focus will be on the implementation of service delivery. Reform continuation will remain important. So on that note, I want to speak briefly about the 2015 budget initiatives, which are all in various stages of development and implementation. Industry has an opportunity to comment on two key reforms, and I really want to hear from you. As you know, from February 27, home care packages will be attached to and follow the consumer. This approach will deliver far greater choice and control to individuals. At the same time, it strengthens the aged care system's ability to deliver more innovative services, both now and into the future, and hence your theme is an appropriate theme. The Department of Social Service released a consultation paper to get feedback from the sector on key policy and implementation decisions. You have until the 27th of October to have your say. There is also a departmental consultation paper on the development of short-term restorative care program, supporting people to regain maximum independence after a hospital stay or avoiding going into hospital altogether is incredibly important work. Getting the design of this program right is important. So again, please make sure you take the opportunity to let us know your thinking. On this one, you have until the 19th of October. Developmental work on other 2015 budget changes, including the development of a single quality framework and private market provision of accreditation services, is well underway. You will seek and engage with the department more on these issues over the coming months. And excitingly, from 1 January 2016, the new Independent Aged Care Complaints Commissioner will commence operations. This change will give people confidence that any complaints they have will be independently managed and addressed. As it separates the management of complaints from the department's role in funding and compliance, it should also give the sector greater confidence. Our day-to-day business is also equally important. In addition to these developing reforms, we are already busy implementing system changes to better support older Australians. In terms of assessment services, I'm aware that the department and the industry are in the process of bedding down a series of changes to information and assessment for consumers. My aged care is now the entry point to aged care services, and from 1 July this year, and that'll include undertaking assessments. This was a significant change, and inevitably some clients, assessors and service providers faced unexpected challenges. The department has been responsive to these operational challenges and has continued to work with our delivery partners to ensure systems and processes reach a steady operational state as quickly as possible. While it's not yet operating perfectly, I understand that it has improved and referrals are now flowing. I know there are other issues that still need to be addressed, and we will address those. Government is committed to continuing to develop and improve my aged care, and I thank you for working with us to that end. I'm also aware of the work being done to develop and deliver the best possible dementia support in aged care services. The health portfolio is now responsible for both the health-related elements, such as research and the care of older Australians living with dementia. There are an estimated 340,000 Australians living with dementia and an estimated 1.2 million involved in caring for them. Government is tackling dementia on the medical research front. We have boosted dementia research with an additional 200 million allocated through the National Health and Medical Research Council. As part of this funding, we've established a new National Institute for Dementia Research. This institute will prioritise and coordinate dementia research across Australia and promote collaboration internationally. Care of people with dementia is absolutely core business for all aged care services, with approximately 50% of all aged care residents having the onset of dementia. I know industry is waiting for the announcement and commencement of the new Service Behaviour Response Team, or SBRT, a mobile workforce of multidisciplinary experts who will support the residential care services delivering care to people with most severe dementia-related behaviours. The teams will assess residents exhibiting extreme behaviours, assist care staff in resolving the immediate crisis, develop a care plan and provide follow-up assistance as needed. The idea for the teams came from the 2014 Ministerial Dementia Forum, another example of government and industry collaboration. What I can tell you today is that the open competitive process to deliver the SBRT has been completed. A national service provider has been selected, and the details of this will be announced shortly. For rural and remote areas, I want to mention one really important piece of work that is occurring. The work of Aged Care Financing Authority, or ACFA, will be critical in understanding the issues affecting the financial performance of rural and remote providers. ACFA's earlier report on factors affecting the financial performance of residential care providers highlighted the importance of strong and strategic governance and leadership on the success of organisations. But there wasn't enough information on rural and remote services to draw any firm conclusions, which is why government has tasked ACFA to look more closely at this issue. This study will include both residential and home care providers. The study will include a large-scale data collection exercise as well as a series of one-on-one meetings with rural and regional providers all over the country. Interested parties have already been able to make a submission to ACFA to put their views and to share their experiences. Can I urge all rural and remote care providers to work with ACFA, because a collaborative approach will give us better evidence base for policies that will work for Australians living outside main population areas. We've always known that one size doesn't fit all, and that the provision of services in metropolitan areas is different than rural towns or areas, which is different to service delivery in very remote or Indigenous communities. This study will help government and the industry to think about how aged care services are best delivered in rural and remote areas. In respect to health integration, one of the things you sometimes see in rural and remote areas is greater integration of all health and human services on the ground. The multi-purpose service model, which I know providers have been raising questions about, and they will be looked at as part of ACFA's work, was originally designed with that intent. I want to come back to the theme of integration because, as I said before that, it is one of the real opportunities that we have before us with aged care returning to health. Over the past 9 months, Minister Ley has been speaking with health professionals, touring innovative medical facilities and listening to the concerns of patients. One of the key themes that has been highlighted right through these consultations has been the connection between health and aged care. Mr. Ley also visited many facilities and has been impressed with the innovative models of care that she has seen, especially those that link primary care with residential care. Just as there is reform in aged care, so too is there reform in healthcare. The Minister has also been looking at ways to improve mental health services, and work will soon commence on private health insurance. One of the major reforms in health is the creation of the Primary Healthcare Network, or PHNs. PHNs have a key role to play in local communities, including the commissioning of health services. When we talk about commissioning, we include a range of elements such as assessing and planning for local community needs, coordinating and linking services at the coalface, right through contracting service provision. PHNs will develop cooperative relationships with GPs, primary healthcare providers and hospitals, with their boundaries aligned with local hospital networks. This will allow for better planning and better management of resources. This is the role they will play in health. There will be variations on how the PHNs operate to meet local community needs, because one size does not fit all. Again, we will see differences in operations between metropolitan PHNs and rural and regional PHNs, and that's as it should be, because areas and markets differ and consumer choices will differ too. Part of this variation may also be the role PHNs could potentially play in aged care. We want to explore what this could be and the circumstances where it makes sense to have them involved. And I look forward to listening to consumers and providers on this relationship between health and aged care. This does not mean that I see aged care as purely about health care, but I'm always keen to explore new ways of delivering better care to all Australians. A binding feature across these reforms is the central focus on the individual, what they need and want to live healthy and independent lives. I am excited to be implementing and driving reform across this portfolio. By the end of this year, Government will receive an aged care roadmap from the Aged Care Sector Committee, which will provide future directions for aged care. And I'm looking forward to working with all of you in delivering consumer-led, sustainable, market-based aged care for older Australians. And I want to conclude by acknowledging the work that you all do, individually and collectively, for Australians whose ageing takes them through the many phases of both their physical and social well-being, plus their need and reliance on the services that you provide within the industry. So I congratulate all of you on what you achieve, and I thank you, and I hope that your deliberations will enrich not only your knowledge, but the capacity in which you collectively will deliver for the needs of ageing Australians. Thank you.